So the TAILORx study addressed this question by randomizing patients who had what we call an intermediate score, but they reclassified what that score was compared to what we traditionally use. So it's a score between 11 and 25 to either get endocrine therapy or chemotherapy followed by endocrine therapy. And what they found was that in that overall intermediate risk group population, there was no difference between either arm, really suggesting that there was no benefit to getting chemotherapy in this intermediate risk group patients. And I think that is really practice changing, because we've not known what to do with patients with an intermediate score to date. We didn't really understand if there was a benefit to giving these patients chemotherapy or not, and now this data really suggests that there isn't a benefit. There was an exploratory analysis, however, that was conducted that I think is intriguing, and one we'll have to think about how best to integrate into practice, because they also looked at younger patients, so premenopausal patients, and they did find that in patients who were at the higher end of the intermediate score, so the 16 to 25 range score, did seem to derive benefit from chemotherapy in that particular subgroup analysis. So, that was an unplanned analysis, but yet this is a large population of patients. And I think it makes one consider, if you have a young patient who falls into the upper end of that intermediate score, that one should consider a discussion about giving chemotherapy followed by endocrine therapy. But for the other population, the postmenopausal patients who have an intermediate score from 11 to 25, there really does not seem to be a benefit to using chemo.